Okay, perfect. I started recording. My name is Emily with Minnesota Valley Action Council. This is the MVAC Blue Earth Nicollet County networking meeting, but I do try to share information that is relevant to our 9 county region. I will hand it over to Jamie with Life Work Planning Center, and then we can move into questions and roundtable after that.
All right, thank you, Emily. I am Jamie Kunkel-Shutter, one of 2 self-sufficiency counselors with LifeWork Planning Center. I have been with LifeWork Planning Center for just over 4 years now. I actually joined the team in January, the year of the pandemic. So I had just finished my training, and then we went home to work, which was a very unique experience. I feel like even though I've been here for 4 years, I'm just getting to know some of you folks now that we're actually able to meet in person, and events are really starting to kick off again. So thank you, Emily, for allowing me this opportunity to share information about LifeWork Planning Center with you all today. The mission of LifeWork Planning Center is to increase the self-sufficiency of women and their families. And we'll go into a little bit how we do that, but just a little bit of background about how we get our funding and how we do what we do as a nonprofit organization and at no cost to our participants. Our Minnesota Family Resiliency Partnership Program, which is a statewide program, so it's available no matter where you're at throughout the state. That program gets its funding through the Department of Employment and Economic Development. We are actually a part of the Adult Career Pathways program. We then operate a privately or locally funded program for those women who may not be eligible under the state's criteria, and we call that Women in Transition. We get the funding for that through our wonderful United Ways, and then different private foundations such as Mankato Area Foundation, grants, and then contributions throughout the community. We are actually in the middle of our Mediathon and fundraising currently. So if you are so inclined to make a donation, now is a wonderful time to do that, as our board is reaching out, they think this Thursday, actually, to folks. So LifeWork Planning Center provides our services to the 9-county region. So Blue Earth, Brown, Faribault, Le Sueur, Martin, Nicollet, Sibley, Waseca, and Watonwan. The way we ensure that we're in all of those communities is that as of right now, we have 2 full-time self-sufficiency counselors. I'm sure many of you have met Sabina L. Haig. She and I split our responsibilities based on county of residence for our participants. So I cover Blue Earth, Faribault, and Martin in Le Sueur County, and then Sabina has Brown, Nicollet, Sibley, Waseca, and Watonwan. There is the entire western part of our state does not have a state-funded service provider. So in those instances, if folks in those counties are interested in services, we can meet with them virtually and provide services as well. So break down to those 3 programs that I already kind of touched on. The Minnesota Family Resiliency Partnership Program, funded through DEED. Something that not everybody is aware of is that if a woman is enrolled in that program with us, it automatically makes them eligible for the Dislocated Worker Program as well. The typical eligibility for that is a layoff from employment, but as a displaced homemaker, state statute gives them that accessibility and eligibility as well. Women in transition, basically any woman facing any major life transition can enroll in that program with us. And then we are also a SNAP employment and training provider. We are a third-party provider through DEED for SNAP employment and training. So an individual may be co-enrolled in SNAP employment and training with DHS as well as with us. We just want to make sure that we have that open line of communication to ensure that we're not doubling up on any services in those cases. So, what is a displaced homemaker? This is an individual who has been dependent on someone else or public assistance for financial support for several years. Statewide, the programs have determined this to be no less than 2 years. A person may have lost the supportive income due to divorce, separation, abandonment, death of a partner, disability of a partner, or maybe they were never partnered, but they've had a loss of public assistance. Not listed here is also deployment. So, our military families, when a partner is deployed, that individuals that's still at home, their income oftentimes goes down. So, we can enroll those folks as well. Another piece of that eligibility criteria is that they are having difficulty entering or re entering the workforce. And this looks very different for everybody. Some folks absolutely have the resume and the interview skills, and the difficulty is navigating childcare or a child that's in and out of childcare because of behavioral and mental health needs. It may be that they don't have those barriers, but they don't know how to put together a resume or how to interview. So difficulty looks very different for each woman. The Women in Transitions program, those women may be just going through any major transitional event. They may be single parents, they may be experiencing a job loss, they may still be married and living with their partner. Maybe their partner is the one experiencing a job loss. We've worked with women through retirement transitions. They may be receiving disability, or maybe they've had a recent injury, and maybe they've never been married. The services that we provide are self-sufficiency counseling. This is done one-on-one. It's often a review of our workshop topics, a more in-depth coverage of it, resume writing, side-by-side job search, and connecting to additional resources. We do career counseling, personal growth and career development workshops, pre-employment training, which pretty much everything that we do falls into that pre-employment training. From the time we pick up the phone and ask somebody to schedule a time to meet with us, that's all a part of the pre-employment aspect of things. Resume writing, mock interviews, and then we could not do what we do without all the other wonderful community support. So lots of additional resources and referrals to appropriate services. Participation for an individual may look like completing our intake or orientation, meeting with a self-sufficiency counselor one-on-one, which the frequency of that looks different for everyone. Some folks meet with us once a month. Some women meet with us once every couple of months. Attending personal and professional growth pre-employment workshops, completing a needs assessment, creating a plan for self-sufficiency. We sometimes call these action plans or goal plans. Completing career interest inventories, personality style assessments, and the Clifton Strengths Finder are all available with us. And then individualized client-driven services. So our workshops, many of you are probably familiar with them. Every season we offer something called Strength, Balance, Self-Respect. This is a 6-week series exploring the essential skills of employment, being confidence, stress management, assertive communication, boundaries, decision-making, and goal setting. We strongly encourage that this is the workshop that women start with before jumping into job search. You got to have the confidence to believe the skills that you're putting on that resume. You got to be able to manage your stress while preparing for that interview. And you've got to be able to assertively communicate your needs and your boundaries to a potential employer so that you can have success both for you and for that employer. So we strongly encourage starting with that series. The job search series then involves completing the Myers-Briggs assessment and exploration of inherent strengths based on those results, pinpointing what your intrinsic motivation for career and employment may be, and then developing resumes and interview skills with that knowledge at our fingertips as well. We offer a stress management and resilience training, and then we have specialized quarterly events. This quarter, we are doing a single caregivers of children resource event in partnership with the Children's Museum, and we're also doing a financial literacy training for our enrolled participants with South Point Financial Credit Union. Evaluation and participant feedback is very important to us. One, as a nonprofit, those funding sources do request outcome information to say what we're doing works. So our evaluation of the strength, balance, self-respect feedback or session gives us that outcome information to provide them in an anonymous way. For me, as a counselor working with the women and facilitating the workshops, it lets me know what's working and what I could change or improve on for the next session. It also gives us really great feedback about potential quarterly events that the women would be interested in participating in. We then also do an evaluation at the time of exit with our participants. So why does it matter? We provide a unique service to women and their families with a focus on family or individual stabilization as a part of that job search, really meeting people where they are at and helping them find that intrinsic motivation for work. We focus on the wants and needs of the participant. We promote autonomy and self-efficacy. We can help women further their education, careers, and personal goals. We do have support dollars available to our participants to break down the barriers to employment, including training dollars. We can help in somewhat limited capacities, pay some tuition and book fees for folks. We can provide the direct support dollars not met by other programs, and we're often serving the unseen, unemployed, or underemployed. That is a wrap on the presentation. So does anybody have any questions?
Hi, this is Cecile from Vine, and I do have a question. So I work with diverse elders, 60 and above, and some of them are women it's, who are in need of jobs. However, my program does not require um, a legal status um, to be served. Um, how about, is that a requirement for your program?
That's a great question, Cecile. So the state-funded program through DEED, yes, DEED
Okay.
requires that we have a Social Security card on file to enroll a person in that program.
Okay.
Our Women in Transitions program, however, we're not required to have any of that documentation. So we could certainly enroll and serve in that capacity. They would still be eligible for all of the same services. The
Okay.
only thing that looks different in the two programs is
Mm-hmm.
because of the funding stream,
Mm-hmm.
support dollars and the
Okay.
availability of support dollars looks different. On average, a woman enrolled in Women in Transition receives $100 to $150 in support for a 1-year enrollment.
Okay.
Whereas in the state-funded program, we can go up, upwards of 2,000 in support. So.
And Jamie, if I recall correctly, you said you don't you help all kind of women, no age restriction, right?
No, well, they have to be 18. That would
Okay.
be the only age restriction. So, Cecile, we have the oldest woman. We actually just chatted about her a little bit today, sharing her story and loving her story. The oldest woman we have worked with is 84 years old, and
Wow.
I think she's got more energy than I do.
Yeah.
So,
And believe it or
um,
I do have women that are in their 80s and their 70s, and they're like fireballs. Like
Yep.
I sometimes have a hard time keeping up with them. And because
Yeah.
I work at Vine, some of these women, they want to come and exercise and, do the cardio and the yoga and the aqua. So,
Yeah.
but I do know that some of them are in need of like employment, jobs, not, I mean, those who have legal papers, but those who are not are looking for anything to teach them a skill, to teach them a little bit of the American culture, the language, and they come from all over the world. That's why I'm asking if they can, benefit from one or all of your programs.
Yes. So, when a woman enrolls, we determine which program will they be enrolled in, and then they hardly know what program it is that they're enrolled in, because really it's just the back end for us that matters. The
Uh-huh.
services that they're going to receive and that they have access to are identical regardless.
Okay.
Um, the piece that I would caution about, well, first of all, before I forget, tune into our spring newsletter, because our success story for spring newsletter is actually a 75-year-old woman talking about how she increased her employment skills to re-enter the workforce
Wow.
at her age. So I think that would be really phenomenal to share with your clientele. The piece that I caution about is that language barrier. Both Sabina and I speak English, and we are a very small team. We don't have the capacity to offer our workshops in other languages. We also kind of come from the stance of, if the ultimate goal is employment, the employment opportunities within your native language are going to be very limited. And we don't want to set anybody up for providing false hope, right?
Yeah.
So when folks come to us and they have that language barrier piece, we can utilize the language line to help identify where is the best place to start with increasing your English speaking skills first, which is usually adult basic education.
We do offer English literacy classes at Vine.
But
So that's another piece that we also are helping the seniors in my program. And I wanted to also talk about in my program. So I am bilingual in English and Arabic. So I support or assist diverse seniors who are Arabic speaking, and I'm also the manager of the program, and I oversee two other staff members. One is Somali, one is Hispanic. So we do cover um, three different languages: Arabic, Somali, and Spanish. And usually, it's part of our services to provide interpreting,
mhm,
translation of documents, and sometimes the employment that they are seeking is an employment with like a minimum communication. A lot of the seniors we see, they have some education from their original countries, and
mhm,
they seem to understand the English. The problem or the difficulty is responding. So they'll
yeah,
say, "Oh, we understood everything," but it just takes us a little bit longer to form the sentence that we want to respond with. But then they do understand and they can respond. It's just the response could be like very simple,
yeah,
but they do understand. So I'm so happy to hear about your programs today and your services, because that that gives me hope that there is something out there that I can connect them with and it could
yes,
be very helpful. Thank you so much, Jamie.
yes. Thank you for your questions and sharing a little bit more about what you do, Cecile.
Thank you.
Any other questions? All right. I usually save it for the very end. How do you get somebody connected to us? Oftentimes that is, a question. How do we make a referral? So we provide through an empowerment model, we provide trauma-informed services. So we strongly encourage self-referral as that first step towards empowerment. An interested person, we want to arm other organizations and resources with our information so that you can identify women in the community that may be appropriate to send on to us. And then just let them know we're a small team. It's not going to be intimidating to call. It's usually myself or Sabina or our office manager, Stephanie, who answers the phone. As soon as we know what county that person lives in, either Sabina or I take it from there. And then that's the person that they're going to connect with. So it's not like calling and getting put on hold and talking to multiple people connecting with us. So they can just call our office. Number is 507-345-1577. It's listed on a flyer that I'm not sure if Emily, you'll share that after the meeting, but I can share it with anybody who wants it. Or they can email info@lwpc.org. We recognize that sometimes anxiety, isolation, trauma is going to be a barrier to somebody self-referring. Oftentimes, some programs are requiring their participants to work with us as well, so they may not be as likely to self-refer in those instances. So in those cases, we just ask, as the referring provider, send us a release of information with that person's name, phone number, email address, and what county they live in. And then Sabina or I will reach out from there. It's always good to know, are you just suggesting this person work with us? Or are they going to have a requirement in order to fulfill MFIP requirements or child protection sort of things or drug court? So
That sounds good. You were very thorough. Thank you so much.
thank
Yeah.
you, Emily.
Yeah, and I'd love to connect more on because I do the adult dislocated worker program. So you mentioned dislocated worker, and that made me super happy because that's a good segue. But I'll move into roundtable and let others speak first. But thank you so much for speaking. I will for sure send because I believe you shared that flyer with me, so I can send that, and I'll like I said, I type up what we talked about today in a summary, and I send that out as soon as I can after a meeting. So.
All right.
Yeah.
Thank you, Emily.
Perfect. Does anybody have any updates to share or events going on? We can move into a roundtable going forward.
I'll start first. I have to get going to another meeting. So I'm Michelle with Blue Earth County Employment Services. And currently we serve people who are on the cash assistance program of the MFIP, Minnesota Family Investment Program, DWP, Diversionary Work Program, and then we also have the SNAP employment training as well. And currently we are short staffed. One of our members, Daniel, has left us, and so we have hired a new girl, and she will be starting on Monday, the 18th. So not to have a caseload right away, but so a lot of Daniel's cases have switched over to me or my other coworker here in the office. So we've been super swamped with just trying to help everybody out. I mean, we have over 100 people that we're just trying to get through for each of us at this time. So, but referrals are coming in, so people are still applying for cash assistance. We're just trying to help them to the best of our abilities, but we're not able to see them right away because we just have so many people rolling in that we're like 3 weeks out on appointments for things. Other than that, that's all I have for our agency update, and have a good day. And Jamie did a great job on her presentation. I do work with her on a lot of different clients, and yep, I really like the Life Work Planning Center. I tell my clients sometimes if they don't want the therapy because they say they don't want to talk to a therapist about their problems. I'm like, a great alternative if you want to work on yourself, talk about yourself, to Life Work Planning Center, because they have tools to help you talk about themselves without having to go to a therapy session. And they don't realize it's their own self-therapy. So anyway, yeah, it's great programming that we can also partner with.
Thank you, Michelle. I can't tell you how many times in a day I say, not a doctor.
Yep.
Not a doctor. So,
I
but
forgot to share. Oh, I'm sorry. I forgot to share with you, Jamie, that I'm also part of Zanta. So we donated some money through Zanta for the Workforce Center, and I believe also the YWCA. So please keep up the good work.
yes, thank you so much for your dedication and commitment to Zanta. That's a phenomenal organization. And we have a shared mission for sure. So thank you.
Thank you all. Bye-bye.
Who else has updates?
I have some updates from
Sure.
Vine I can share. So we received a dementia grant, and we've been expanding some of our dementia programs at Vine over the last few months. So we've added a support group for a caregiver support group in Le Sueur. And that's in addition to the support groups we are already offering in Mankato that are monthly. We've also added an additional monthly support group in Mankato for people who are still working. So it's a later support group. Most of our support groups take place during the daytime. We've added one that starts at 5:15 p.m. So for caregivers who are still working to accommodate their schedules. We are also doing different dementia-related programming, educational programming that is free and open to the public to attend. So the next one we have coming up is actually tomorrow, a presentation from Dementia Friends of Minnesota. That is going to be March 14th at 11 a.m. Every other month, we're also offering free memory screenings. So again, tomorrow we have free memory screenings going on. We will be offering more in May. If the dates don't work for people, though, we encourage them just to call us and we can set up a private appointment with them. They take about 15 minutes, and it's just a quick screening done by trained staff. That'll tell somebody if there is something to be concerned about, and we'll recommend them go see a doctor if there is anything alarming that shows up in the test. We've also added a dementia-friendly fitness class that is for both people who have dementia as well as their caregivers, and that is also free and open to the public thanks to this grant. Those classes are held on Tuesdays and Fridays from 11:30 a.m. to 12:15 p.m. So it's a fitness class for people with dementia and their caregivers. It's not just about the fitness, though. It's also about the socialization piece, because a lot of people with dementia and their caregivers end up being a little more isolated than others. So it's a great opportunity for people to get out and get physically active as well as communicate with their peers. We also have we're bringing back foot care clinics to Vine. It's something we used to offer pre-COVID. And then, COVID shut it down for a while, and the RN that we were working with that was providing those foot care clinics is no longer at the organization. And so now we have partnered with MSU's nursing students. So students and faculty will be offering foot care clinics at Vine on a monthly basis. The first one starts on March 20th from 1 to 5 p.m. Appointments are about 30 minutes long. They include feet cleaning, a foot assessment, as well as toenail clippings and a little massage. Those are $10, and people do need to pre-register for those appointments and bring their own basin and towel. We also are going to be offering a brand new class for people with low vision or people who are blind. It's called Tai Chi Huan for low vision. It's the first that's going to be offered in this area, and it will also be free and open to the public for anybody who is hard of seeing. Those classes will begin on March 18th. It'll be a series, so people have to sign up for the whole series, and it'll be run through May 17th. And again, those are free and open to the public. They will be held here at Vine 11:30 a.m. to 12:30 p.m. We do have limited capacity for that class, and I believe we only have like maybe 2 spots left because we're trying to keep the class small since we're dealing with people with difficult or low vision. And then also one last evidence-based program we have coming up is the diabetes prevention program. That's a program we've been offering for many years here. It is a year commitment, so for people to sign up, they need to definitely be committed. It will begin on April 18th. And it again is for people who are pre-diabetic with the purpose of preventing developing type 2 diabetes. We have 2 info sessions coming up about the program where people who are interested can come and learn more and talk to the instructors. Those are going to be held March 21st and April 4th at 11 a.m. here at Vine. And again, that's also free and open to the public. And then lastly, True Transit is now serving Eagle Lake residents. We were serving the Eagle Lake residents before. True Transit, for anybody who doesn't know, covers Blue Earth, Nicollet, and Le Sueur counties. But prior last year and for many years, the city of Mankato covered Eagle Lake as part of their Mankato area transit. So we were unable to provide rides between Eagle Lake and Mankato because the city of Mankato was providing those rides. So when we found out in the fall that the city of Mankato was no longer going to be covering Eagle Lake transit as of January 1st, True Transit is now be able to cover that. So we are definitely much busier. We've gotten a lot of ridership between Eagle Lake and Mankato. So if you know of people who are in need of rides in Eagle Lake, and before we used to tell people we can't do that, we can now do that, and we are doing it. We are running back and forth between Mankato and Eagle Lake quite a bit right now. So it's all dial-a-ride service, Monday through Friday between 8 a.m. and 5 p.m., $5 each way. And that's
Perfect.
it. Any questions?
Thank you so much. Can you just clarify the age minimum again for when you say free and open to the public? Is there a minimum for some of the ones you mentioned?
Most of them are obviously geared towards older adults, but
Yeah.
I would say for being a member of the Vine Adult Community Center, we always say 25 and older. But as far as True Transit goes, it is public transportation, so any age is welcome to ride on the bus.
Okay. And for general Vine, it's usually 55 or older or 65?
25 and older for being a part of the Vine Adult Community Center. We do have, for some of our Live-Well at Home services, we do have an age requirement of sometimes it's 60, sometimes it's 65, but the presentation or the items I discussed today do not fall under that. So
Okay.
It would just be 25 and older.
Okay. Thank you.
I can share information on the Project Community Connect. I'm Kate Henge-Gretz with Lutheran Social Services Crisis Nursery. And the Project Community Connect is going to be on Tuesday, April 16th. And it's a one-stop resource event. And we advertise in the 9-county region. And we encourage people who are struggling financially to come. We don't do any kind of screening, so basically anyone can come. There will be free haircuts, a free lunch. We'll have a booth where people can get vouchers for Minnesota identity documents, things like driver's licenses, state IDs, birth certificates, that type of thing. The vouchers do need to be used at the Blue Earth County License Center. This year only, we will have Josh Madsen there taking photographs for his 2024 Mankato Community Collage. So if people have their photograph taken, it's with the understanding that a photo will be used in the community collage. Right now we have about 80 vendors coming. Everything from county financial assistance to food shelves. There's going to be 6 or 8 tables staffed by MSU allied health and nursing students. So I think they'll be doing blood pressure checks, maybe glucose, maybe foot exams. I'm not exactly sure what all they're doing, but that will be fantastic. Can't remember if I mentioned free lunch. We will have someone there doing face painting this year, first time ever. And we are bringing back childcare. So it's the first time since COVID that we will be having childcare services available. We do still need about 20 volunteers. So if you know of anyone who would like to volunteer, just give them my phone number or email address. And then what else was I just going to say? If I think of it, I'll chime back in. But what I was going to say is that if you are not sure if your agency is signed up, I can connect you to the person who's in charge of registrations. And if your agency can't come and have a booth, and you want to attend as a professional, we certainly encourage that. The event is from 1 until 4, and I normally encourage professionals to not come between 1 and 2 o'clock because we are so busy with the guests who are there looking for services for themselves, that I encourage the professionals to come, sometime maybe around 2:30 or so. Thank you.
I can chime in. So the adult dislocated worker programs, specifically dislocated worker, still looking for individuals. Jamie briefly covered kind of the displaced homemaker portion of that, but also long-term unemployed, laid off due to no fault of their own and are or were receiving unemployment, among a few others. The Adult Career Pathway Networking Day is going to be Friday, May 17th, I believe from 8:30 to 12:30. They'll have a registration link soon. We're working on figuring out sessions and whatnot. So if you are watching out for that, save the date. I can also send the save the date flyer for that. The partner training day for the career force partners is Thursday, April 18th, 8:30 to 4:30, and that's at the South Central Service Cooperative. So again, save the date for that. Kate mentioned Project Community Connect for me, so that's awesome. Thank you so much. And then I believe somebody mentioned some programs about seniors earlier. Cecile, I believe. So I just wanted to throw a tag out there for this senior employment program at MVAC. We can help seniors that are looking for employment do a paid work experience at a nonprofit through our senior employment program, SCSEP. So I'll put that in the summary as well, because that might be a good connection to make as well if some of your participants are looking for employment. I'll also just have a reminder, we do have an agency newsletter. I can put that in the follow-up as well, how to register for that, just for updates. Yeah, I think, and then our young adult career development program as well is still looking for youth 14 to 24 for work experiences. So if you have clients or know people with children of that age that are wanting to explore work readiness programs or get a work experience, they can earn credit through elective credit through high schools. Not all high schools, but most of the high schools will accept elective credit for students who do a work experience through our program. So that's an added benefit for students that are maybe behind in school, but great program. So if you have clients or know family members who have some youth or young adults that want to explore the workforce or maybe do a paid internship, maybe they just want to explore a field that they're maybe considering going on to school for, that's a great option or avenue for them to take. So yeah, I will pass it on to anyone else with updates.
Emily, I have a question for you. If there's a youth whose family has decent income, but the youth has a diagnosed disability, do you still look at income guidelines?
They would look at if we would have documentation of a disability, they would look at the youth income and the parent income. We would still need the parent income number for enrollment purposes, just a number on the application, but we would only look at the youth for eligibility income requirements. So that's a good question. Yes. And then for referrals, I guess I totally forgot that part. To connect somebody to the youth program or the senior program, we have an info or referral link on our websites. It's right on the programs tab. And I think it's like 10 questions, maybe just name, contact information, maybe some general demographic information. And then the program contacts will reach out based on what county the person lives in. So that's a great way to get connected to our MVAC programs. As far as the adult dislocated worker and other adult career pathway programs that we have for adult training, enrollment happens through Career Force. The Career Force is offering the title is Dislocated Worker Information Session, and they are having 2 of them every month. And the times for that at the Mankato Career Force can be found on the Mankato Career Force website. So I will make sure to send that in the follow-up. Otherwise, if you find somebody outside of our service area, going to their local Career Force would be a great way to connect them to the same statewide services in other services service areas. So yeah, and feel free to always send people my way if they need help navigating that process. I'm happy to help with that. So perfect. Well, if nobody else has updates, then I can give you back some of your time today. I'll do my best to try to recap and send this information out, and any flyers that I have. Our next networking meeting is Wednesday, June 12th. From 1 to 2. I believe I have the link set up, so it should be available on your calendar. But I'll, as always, try to send a reminder closer to that day. I don't have a guest speaker at this time. I have a couple I'm considering, but as always, if you have ideas or if there's an agency you want to know more about, feel free to send the suggestion to me, and I can certainly explore some options or reach out to those agencies if you've heard of some and just want to know more and don't know how to get in touch. So awesome. Thank you so much. You guys have a great rest of your day, and hopefully see you in June.
Thank you, Emily.